Hello, my name is Teresa Pina. I am currently working at Lakeland Regional Medical Center in the dialysis unit. My short-term goal is to earn bachelor's degree in nursing at Florida Southern College. Therefore, it will enable me to provide highest quality of care at a bachelor level nurse. My presentation is about Dorethea Orem. Dorethea Orem was born in Baltimore, Maryland in 1914 and passed away on June 22, 2007 in her residency in Skidway Island in Georgia at 92 years of age. Dorethea Orem received her diploma from Providence Hospital in Washington, D.C. in 1930. She earned both Bachelor's of Science in Nursing Educator and Master of Science from Catholic University of America in 1939 and in 1946. Georgetown University honored Dorethea Orem the Doctor of Science degree in 1976. Dorethea Orem received many awards in her lifetime and are as following. In 1980, the Catholic University of America Alumni Association awarded for nursing theory. In 1980, she was honored the degree of Doctor of Science Incarnated World College, Doctor of Humane Letters from Illinois Wesleyan University in 1988, and in 1991 she was awarded Linda Richards and National League for Nursing. In 1992, she was honored Fellow of the American Academy of Nursing, and in 1998, she was awarded the Doctor of Nursing honoris causa from University of Missouri. Dorethea Orem worked as a staff nurse in multiple settings. She works as a private duty nurse, operating room nurse, pediatric unit nurse, nurse educator, in the emergency room, supervisor, administrator, and nurse consultant. From 1940 to 1949, Dorethea Orem worked as a director of nursing school and at the Department of Nursing at the hospital in Detroit. From 1949 to 1957, she worked in the Division of Hospital and Institution Services of Indiana State Board of Health. From 1958 to 1960, she worked on a project to upgrade practical nurse training, guides for developing curriculum for the education of practical nurse, Orem 1959. Dorethea Orem also worked as an assistant professor of nurse educator at the Catholic University of America and served as an acting dean of School of Nursing and as an associate professor of nursing educator. Dorethea Orem left the Catholic University of America in 1970 to start her own consulting firm. Dorethea Orem published her first book in 1971 titled Nursing Concepts of Practice. Dorethea Orem was an editor at Nursing Development Conference Group, which contributed to the development of theory, and later revised concept formalization in nursing, process and product in 1973 and in 1979, and in 2004 a second edition was reprinted. Editions of nursing's concept of practice were published in 1950, 1985, 1991, and 2000. Dorethea Orem retired in 1984 and continued to work alone and with other colleagues on the developmental of self-care deficit nursing theory. Quote, nursing belongs to family of health services that are organized to provide direct care to persons who have legitimate needs for different forms of direct care because of their health state and requirements. Dorethea Orem, 1997, identified 5 broad views of human being that are necessary for developing and understanding the concept of self-care deficit nursing theory and understand the interpersonal and societal aspect of nursing system, people, agent, symbol, organism, and object. Nurses use self-care deficit model with clients with different diagnoses to provide individualized patient care. After gathering the information from your clients and work closely with the physicians and their orders, the nurses develop an individualized plan of care accordingly to the patient's problem. First, you need to assess the developmental state, age, health state, family system, social, economic, cultural factor. Second, depending on the physical condition and the degree of the illness and the health limitation. Third, after gathering all the information and your assessment, you would have to plan the care. Caring for self is a human regulatory function that individual must do or must have performed for them to maintain life and well-being. As nurses, we need to encourage, we need to promote, we need to engage, and we need to teach self-care as soon as the client is able to engage in their own care to promote patient independence and have a speedy recovery. Self-care deficit is important for nursing research because this area is used widely in nursing process to guide the practice of nurses and to continue to improve the care we provide to our patients. Everything we do now is based on research and evidence-based practice to provide best care possible to our patient. Dorethea Orem self-care deficit nursing theory model is used worldwide. The following schools use the self-care deficit nursing theory curriculum framework. In 2008, the following hospitals and nursing school started utilizing the self-care deficit model. Illinois Wesley University School of Nursing, University of Tennessee in Chattanooga, College of St. Benedict, Anderson College, University of Toledo College of Nursing, Alcorn State University, Cora S. Balmont School of Nursing, Southern University, Baton Rouge School of Nursing. Quote, nursing is practical endeavor, but it is practical endeavor engaged in by persons who have specialized theoretical nursing knowledge with developed capabilities to put this knowledge to work in concrete situation of nursing practice. Orem 2001, page 161. Reference that I used is nursing theorists and their work, journal articles, case study research. Thank you.